My name is Chris Carpenter. I am a pediatric hospitalist by training. So I work with sick kids in the hospital, but have also had a really rewarding and fun career in global health. And I wanted to talk today a bit about a project that I work with local colleagues in Haiti during my global health fellowship on the East Coast. So I was assigned for my fellowship, I was assigned to work with Partners in Health in Haiti. And this is a country that shares the island of Hispaniola with the Dominican Republic. And I worked in a small town north of Port-au-Prince called St. Mark. So a little bit about Haiti. The population is just under 2 million, 10 million. And the population of the Dominican Republic is just around 10 million as well. And here are some statistics that you will see, the average annual income and some of the health statistics. Child mortality is mortality of kids under 5. Infant mortality is under 1. And neonatal mortality is within the first month of life. And you'll see the comparison statistics for the United States. So this is the little town I worked in, St. Mark. There is a trucking and distributive route that goes from Port-au-Prince, just right here, up through St. Mark to the northern area in Cap Haitian. So St. Mark is fairly populated, and it has quite a bit of transit from people going from Port-au-Prince up to the north. And I worked in a small hospital called St. Nicholas Hospital. This was the referral hospital for the region. It had services in internal medicine, obstetrics, gynecology, had great surgeons, and also had a pediatric department. And I worked in the pediatric department. And soon after I arrived there, I realized that they were able to care for kids very well with acute illnesses. So kids that had appendicitis, pneumonia, sepsis, and in this case, a Benson, who had a severe acute malnutrition, they had the protocols and infrastructure to be able to treat him very well. I remember one of my first weeks working in Haiti, Benson came in. I saw him. I was quite struck by how malnourished he was. And my Haitian colleagues really took over and managed his care very well. And this is a picture of him just about 1 week later. You can see the difference. So a marked transition from being very malnourished to it looking much better. And we were able to discharge him soon after. So I realized that acute care in Haiti was really not the concern. So after working with my colleagues and discussing how we could better support the care in this region, we decided a plan to start addressing some of the chronic diseases that they were seeing. And I did want to state that all of these pictures have consent from both the patients and the family members. So a little later in my first year there, we had a patient named Valencia, and she presented to the emergency department with type 1 diabetes and something called DKA, diabetic ketoacidosis. And we did not have the medicines to treat her, so we didn't have insulin, and we didn't have the supplies we needed to test her for her diabetes. And so she was on our ward for several days, and she had high sugar levels and low sugar levels. And at one point, she started having seizures because she dropped her sugar levels low when we ultimately found some insulin for her. And in discussing with the team and our local colleagues, she is the one that planted the seed that maybe if we started a unique way to treat diabetes in this region, we could be able to help patients like Valencia and other patients in the regions. And so we came up with the idea to start Kai Mackinson Clinic. And Kai means home, and Mackinson was actually our second patient that we took care of at the clinic, and came up with the idea of a comprehensive care for chronic diseases. and has both an inpatient and an outpatient services. And we take care of diseases such as diabetes, rheumatic heart disease, kidney disease, epilepsy, asthma, sickle cell, and we've done some cases in kidney disease, nephrotic disease, and chronic infections. Our facility has been open since December of 2012, 24/7, 365 days a year. We did close for one day after the presidential assassination in 2021, but other than that, we have been open every day for the last 11 years. It's an entire Haitian staff that runs the clinic and makes all of the decisions for the clinic. So we have a Haitian medical director, several nurses, manager, social worker, nutritionist, psychologist, ophthalmologist that work in the clinic to help care for our patients. And I thought I would tell a couple of patient stories that really highlight some of the care that our team does. This was Micheline. She was 17 years old at the time of this photo. And she had been diagnosed with diabetes when 2 years prior and was living in the mountains above St. Mark. And her family was spending about $100 per month on her diabetes supplies. And just before she came to the clinic, she told her family that I don't think it's fair that you're spending all of your income on my care and not able to send my brothers and sisters to school and to feed the family. So she made the decision that she wanted to stop her diabetes care and just be allowed to die at home on the couch while her family spent the resources with the other kids. Fortunately, a traveler coming through the region heard about her and heard about our clinic and brought her down to our clinic. At the time, so she was 17 years old and weighed 17 kilograms. So that's just under 40 pounds. And we got her into the clinic. We started using insulin that we had, and we started a nutrition program. And this follow-up picture is several months later, fairly intensive therapy that we did. And after we did a eyesight surgery for her to allow her to see for the first time in several months. And that is Micheline, just after we took off the patches for her eyes for her to be able to see. The next patient we have is Rosalind, and I met Rosalind on one of my visits over the summer, and she was just a bright young lady and really engaging and interesting. And I had several dinners with her when she was first admitted to the clinic and heard about her life and her stories. And then I came back 3 months later, and a young lady came up to me and gave me a hug and welcomed me. And I said, "It was very nice to meet you." And she looked at me funny. And one of the staff members said, "This is Rosalind. You got to know her 3 months ago. And this is the picture I took after I told her, I'm sorry, I didn't recognize you." She has transitioned back home and is doing great. She's actually had 2 children and doing really well in the community and continues to be a patient in our clinic. Overall, we have about 140 children with type 1 diabetes, and then smaller populations of our other disease processes. We do quite a bit of research on diabetes outcomes, on long-term control, and one of the first studies in an under-resourced setting looking at progression of eye disease in children with diabetes. We've got some great data about blood thinning in kids with rheumatic heart disease after they've had a valve replacement and able to keep their blood thinned in a very resource-poor setting without electricity and running water. And then recently had a study that looked at lead levels and throughout the region that were quite high, and the first study of its kind in Haiti. This is a community event that was led by our head nurse just here, our administrator, and these are all patients or former patients that we have that are now community advocates. And really helping both get outreach about diabetes in this instance and teaching the community, but advocating for both parents and kids to seek medical care. We had a yearly diabetes camp that we put on until there was political instability. This was our first camp that I believe there were just over 40 kids. And then our subsequent camps, we had 80, 100, 120 kids that would join us for a 2 to 3 day session of having fun, learning about health, and bonding. This is a amalgamation of both volunteers, kids, patients, and our clinical staff. And lastly, this was a young man that he came into our clinic for, he had some kidney problems and we treated him for quite a long time. And I asked him if he wanted to say anything on camera about the treatment that he received or things that he enjoyed about the clinic. He didn't want to say anything, but he said, "Can I show you something?" And then he did this little dance. So he was quite proud to be a part of the clinic. And so thank you for your time. That is a short overview. I often do this over a 1 to 1.5 hour. So it's a pretty quick snippet. But I think overall, we're really happy with what we've been able to achieve. It has been really a Haitian physician, Haitian nurse, Haitian staff-led intervention. And I have been honored to work side by side with my colleagues to keep this going over the last 11 years. I'll turn it over to you, Ingrid.
Thank you so much. I'm going to just jump right into the info session now, and then we'll do frequently asked questions and open the floor for questions after that. So let me just move. There's a couple of Zoom things. Just going to hide this. Okay, so we are the first global health sciences master's program in the country. And our institute was established because leaders recognized that the way health sciences was dealt with back in the late 90s, it was siloed. So the different people involved, the academics, the policymakers, the implementers, and the funders, these people weren't talking to each other. And the consequence was a lost opportunity for impact, where things weren't working as well as they could. So back in the late 90s, our leaders created the Institute for Global Health Sciences so that people from different disciplines could come together, they could talk to each other and solve problems with the purpose of achieving impact. And a few years later, mimicking this process, we created the Master of Science program in Global Health Sciences, where students can come together from different disciplines and learn how to talk to each other to solve problems, so that when we work together, we're stronger. So a bit about the program itself. Our program is very intense. It's a fast program. It's 11 months. It includes 10 weeks of global health field work, and our curriculum is interdisciplinary. So we learn about all of these different fields that talk to each other. We have amazing faculty. A lot of cutting edge research in global health is happening right in our building. And in terms of our culture, we think a low faculty to student ratio is a key element of success in our programs. So if you come and join us, we want to get to know each of you and to propel you on your journey during this short and intense year. We strive to train you for global health service and leadership positions, preparing you for careers in research and policy, organizational leadership, and program management. And our executive director, Dr. Jaime Sepulveda, he arranged for this building, Mission Hall, to be built. For us, it's awesome. The classes take place on the first floor in large classrooms downstairs, and there's research happening throughout the building. So by coming to class, you have access to all of these researchers in the network. Mission Bay campus itself is one of the sunniest places in San Francisco. It's a really fun place. It's booming rapidly. There's so much innovation in biotech. There's a pretty new hospital right across the street, so people get helicoptered in. Amazing care is happening right there. The neighborhood is bustling. There are restaurants. There's a gym across the way. It's a great place to be. So you would spend the bulk of your time here. And while you're here, let's talk about the curriculum. Today, we have a big focus on scientific methodologies for your groundwork. So these include quantitative methods, qualitative methods, epidemiology, biostats, global health economics. Then we go into diseases and determinants. So we give an overview of communicable and non-communicable diseases, and we explore the sociocultural determinants of disease. In the last block, we think about systems. What are the different types of health systems? How do they function, and what are the pros and cons? How did they come into being? And how about health policy? How are they influenced, changed, implemented? How well are they working? How do we evaluate them? And alongside all of this coursework, you'll be doing a capstone research project that starts the moment you enroll in the program. And so when you come to orientation, we send a capstone interest survey. And it's not binding, it's just an early questionnaire to start the process of thinking about what you're interested in. So I'm going to talk about this in a little more detail shortly, but the capstone is a curated research project that we work with you very closely on throughout the year. And through this process, you learn how to develop research questions, you defend a proposal. In the spring, you have a qualifying exam. And then you go off and do your research, you write it up, you package it, and that's the close of the year. In addition to the coursework and the capstone project, being here means that you're immersed in a global health scientist environment. So we have many enrichment opportunities, and I want to just share a few examples today. One that I want to highlight is Grand Rounds, where our executive director, Jaime Sepulveda, he reaches out to his extensive network of incredible leaders in this field, and he asks them to come in and talk to you. So they give lectures on cutting edge topics. So the picture here is one of my favorites, Madhu Pai, and he told us about decolonizing global health in the spring of 2020, before the topic became really big. More recently, we've had Tony Fauci come in and talk with Eric Gooseby, who works in our department. He was an ambassador and one of the major players in PEPFAR for HIV/AIDS back in its highest point. And then Chris also had colleagues from Partners in Health come in recently. So Grand Rounds is always a highlight. In addition to this, there are numerous other opportunities for professional development. And these include networking, movie screenings, and you can see the classroom environment here with some of these events happening. So one main draw of our program is the Capstone Research Project. It's certainly a big reason why I came here to do the program. And in this project, you apply rigorous scholarship to active global health projects in the US and around the world. And if you haven't seen this on our website already, come and check it out. This is interactive, and the countries in green are where at least one student did a project. So you can hover over it and you can see what the titles of the capstones are. I did my project in Myanmar, and because it was a pretty short window when it was safe to travel there, yeah, that's my contribution to the map. But yeah, you'll see our students have gone to so many places, and the map is ever growing. So we've had hundreds of opportunities throughout the years, and I'll give you a quick snapshot today. Just bring this to life a little bit. You can see on the top left, people, students doing HIV/AIDS prevention work in Uganda. To the right, health promotion in Honduras. Bottom left, system strengthening. That one's also in Uganda. And then bottom right, snakebite prevention in Nepal. So how does the process of curating the Capstone Project work? Well, this is really iterative, and we make sure through that process that you you gain the skills you're interested in as close to, when and where. So we start with asking about the skills you gain, and generally the categories are quantitative methods. So you can say, I want to do a deep dive doing a large survey somewhere, or qualitative methods. You might say, I want to go to the Caribbean and conduct in-depth interviews to learn about people with diabetes. You might want to do a deep dive on statistical analysis, working on a genomics database, for example, to look for patterns and determinants of disease. You might want to get experience with program implementation and go do work on the ground and see how things are done, or monitoring and evaluation. How does the cycle of funding and indicator assessment work? You may want to do a policy analysis on a specific topic. So how is this playing out? What are the barriers and facilitators to implementation? Or a cost effectiveness analysis, which is what I did for my capstone. At the very end of it, my results were used to inform the Ministry of Health in Myanmar on how to roll out rapid diagnostic tests for malaria in the informal private sector. Or you might want to do a systematic review where you do a deep dive on a specific topic and become the leading expert in that one area. So after we talk about skills, we also ask you where you're interested to work. So these are general regions or countries or populations you're generally interested to work with. And then, of course, we ask you about topic areas. So we've had hundreds of topic areas studied throughout the years. I'll give you a quick smattering today. Mental health, health literacy and promotion, HIV/AIDS and prevention, reproductive health, communicable and non-communicable diseases, water sanitation, hygiene, immigrant, refugee health, women and children's health, malaria, zoonotic disease, healthcare systems, capacity building. So we're all over the map. So anything global health related, you can bring to us. So I mentioned earlier, an important part of our program is working closely with you and providing mentorship. So at the beginning of the year, we assign each of you faculty advisors, and we match you based on similar interests. So you can meet with your advisor monthly or more. It's up to you on what kind of advice you are seeking. So you can tell your advisor, I want advice on my research. I want career guidance. I want to get feedback on my capstone. Or I just want to get to know you and learn about your story and get your advice whenever I have questions. And in addition to faculty advisors, you'll have at least one capstone mentor. So this is determined by the project. So it's usually assigned when your project is confirmed after this iterative process, usually sometime in October. So if you join us, your support team here is pretty extensive. So we have you here in the center. And as I mentioned earlier, we have a low student to faculty ratio. So our faculty are really dedicated. We want to get to know you. We have regular meetings, just talking about each of you to make sure you grow as much and learn as much as you can in the program. And we also welcome feedback and interaction. Every cohort is different, and we try to tailor the program and the way of teaching to match the cohort. The advisors that I mentioned earlier include capstone mentors and co-mentors. So for capstone mentors, I had three. I had one on cost effectiveness analysis, one on healthcare delivery through the private sector, and then both of these professors were pretty busy. So they also paired me with an assistant professor that I worked with very closely with on epidemiology and the project itself. After the capstone period, they actually invited me back to Myanmar, and we all traveled together. When we present to the ministry. So starting from day one, they work closely with you throughout the year to develop the project. We have course assistants, and these are unique to the program. They might be similar to the teaching assistants you had in undergrad, but they're all alum from the previous year. So they're familiar with the program, and they have both the student and the teaching perspective. So they're there to help you with courses throughout the year and also to support you. They're there to get to know you and support you throughout your journey, having been right there. We have an education team. We meet regularly to make sure everything's done as well as possible. And we really value regular open communication with you. We're actually meeting with the student council later today just to check in on everything. So that's an important part of our process. So where do our graduates go? There are 4 main buckets, and we're currently actively looking into this to get further details, this being our 15th year. But, the main buckets, we have academia. So we have a lot of our students become clinical research coordinators, faculty in pediatrics or deputy director. We have many of our graduates go into the private sector. So, for example, clinical specialists, innovation partnerships leaders, business analysts. We have, some of our people go and start their own companies. So one of my classmates, he started Zipline with a number of people. A lot of innovation around here. A number of our students, our graduates, also join government and NGOs. So a few examples: researchers, program analysts, program managers, research analysts, and scientists. And a lot of our students also go and get advanced education and training, although some already come in with advanced degrees as well. So a lot of these are clinical, really close ties, a lot of medical students, dentistry students, and also researchers, doctoral students. So if you're wondering if your background is suitable to apply, it probably is, because we rely on diversity in our classroom to bring the conversation alive. So, when we started the session, I mentioned about how global health sciences was created to bring different disciplines together, and our classroom aims to mimic the ways that decisions are made in global health settings. Our students come from all sorts of backgrounds. A few examples: people will come in with bachelor's degrees. We had lawyers come in, people with PhDs. I had one when I did the program. A lot of people come in with advanced clinical degrees, dentists, pharmacists, medical doctors, nurses. And our students have a lot of experience, different kinds of experience they come in with. Some are, volunteer experiences or experience from undergrad. Others are, different professions. So clinical healthcare providers, EMTs, nurses, physicians. We've had engineers join us, researchers, biochemists, teachers, and people come from all kinds of jobs and background areas of study, which really enriches our cohort and the types of problems people are able to solve. So few examples here. You'll see a lot of science, but also we have English and philosophy majors who have come join us, people working in health education or industrial engineering, nurses, psychologists, public health practitioners, people who have worked in religion, health, and medicine. And it's this diversity that really makes our program unique and our cohort strong. We can learn from each other and we can learn from you. So the last thing I'll go over today are nuts and bolts of the admissions process. So you've probably seen the components on the website. We ask for a personal statement, for resume. We ask for transcripts. Prohibitive, please feel free to reach out and we can probably arrange a waiver for you. We don't require GRE or MCAT scores, but if you have these, feel free to include them in your application. It's entirely optional. We review admissions holistically, looking at the whole package together. So admissions are open now. We do a ongoing review of completed applications. If you're admitted, we can help you with planning. We can start talking about the capstone right away. And we encourage you to apply whenever you're ready. So a few deadlines. Sorry, we've extended this a bit for the merit-based scholarships. So I think in the next round, we'll still consider them. But yeah, I think if you want to fundraise, please apply as soon as possible so that you can start that process. And we're here for you to talk about how to apply for funding. The international students, we ask for their applications as soon as possible to arrange for visas to come to San Francisco. The Final deadline is in mid-June, so we encourage you all to get in touch. And we want to hear from you. We want to learn from you. You can see our email here, education.globalhealth@ucsf.edu. So feel free to get in touch. And at this stage, I will hand over to Chris now on the frequently asked questions.
Perfect. Thank you, Ingrid. It's always so inspiring to hear you talk. I appreciate it. So I have 3 frequently asked questions, and then I think we can launch into questions from the crew here. So when is the best time to get a master's degree in global health? I think there are 3 categories of students that we usually enroll into the program. Students that are just finishing their undergrad degree, and these are students that want to gain a specific skill that Ingrid talked about in quantitative, qualitative research, do a deep dive into a particular research topic, or gain some sort of contextual background with a health equity focused lens. And then some students just really want to expand their global health network. And these are students coming just out of undergrad. We also have a cohort of students that are coming after advanced clinical training. So they want to be immersed in kind of the larger health structure discussions that we have throughout all of our classes and small group sessions, and gain a greater understanding of both systems and policy that they are working at. And then lastly, we have some students that are coming after they have completed all of their training. So they have completed either a doctorate or a residency, and they are looking at gaining an additional skill set or pivoting in their career, or just really want to engage in that immersive space, thinking about health equity, about systems, and about diverse populations. So we have just across the spectrum of students that are quite young in early 20s, and then we have students that are a little older like me that are coming through. So it's a really fun, engaging cohort. Next question. How have previous applicants made the decision to join this program versus a MPH? This is an important question to me. I did a MPH about 20 years ago and really loved it. But a master's program was not offered at that time. And I think about this quite a bit. There are some fantastic MPH programs, and there are great other master's in science programs in global health. So I think it is a difficult decision, and I think why many of you are here today to learn about this. I think, as Ingrid highlighted, the research focus component to our master's program really draws in quite a few students that really want to take that deep dive over the entire 11-month master's program so that they can really focus on their Capstone project. And many students will use the Capstone project as the springboard into their career. I think the other reason that students tend to choose UCSF in our master's program is our network of faculty, both at the health sciences, health fields, and within the larger global health community. It's just a really exciting place to be, and the energy is great. When I first started last summer, the Warriors they were opening just across the street, and the students were excited for the classes, and we were walking into one of our small group sessions, and Charles Barkley and Shaquille O'Neal just walked right by us. And so it just kind of has that fun energy all around. And the last question, and then we'll turn it over to the group, are what are ways that I can think about the finances for the education? And the tuition is high. Tuition in graduate school and undergrad can be quite high, and is a very important decision when you're thinking about moving forward. I try to encourage students that the master's program is a one-year program. There are quite a few 2 years master's programs that spread out the tuition over 2 years. Ours does compact it into 1 year and is fairly equivalent with other programs. I think there are definitely scholarships to apply, and Tammy does a great job in helping students find and apply for financial support for scholarships. Myself, Ingrid, the rest of the education team are happy to write letters of support once you are engaged in the program and are applying for financial support. I would be very happy to write letters of support or as a reference for those opportunities. Some students do ask about working either during a research component during the master's program or working to financially support yourselves. We try to encourage students to work or do outside activities for less than 10 hours per week, just so that you can fully engage in the master's program and be there and grow and learn with the cohort. It can be an immersive, intense environment in some time periods during the master's program. So if you can limit work or outside activity to less than 10 hours a week, I think you'll get the most out of the program.